Good afternoon and welcome. I'm Senator Bill Preston. This is part 3 of our continuing COVID discussion series. And yes, it's a series 1, 2, 3 on the fiscal, monetary, and health policy responses and the implications for the economic outlook. Our discussion is sponsored by Princeton University's Griswold Center for Economic Policy Studies, the Center for Health and Wellbeing, and the podcast, A Second Opinion, Rethinking American Health. I'm excited today to be here with Princeton University's Jessica Metcalf, Alan Blinder, and Bill Dudley. Our discussion will look at our current understanding of the physical, the monetary, and the health policy implications of the ongoing pandemic, continuing to build on the themes that we discussed in our 2 previous webinars, the first on April 2nd and the second on June 9th. I will add, if you missed those earlier discussions, you can find them at either a secondopinionpodcast.com, that's the website, or on the Griswold Center website as well. A little about our presenters today. Jessica Metcalf, Assistant Professor of Ecology, Evolutionary Biology, and Public Affairs at Princeton. Professor Metcalf is a disease modeling expert. She's going to kick off today's discussion, offering the latest understanding of the epidemiological trajectory for the disease and the larger health policy implications. Alan Blinder, the Gordon Retzler Memorial Professor of Economics and Public Affairs, former Vice Chairman of the Board of Governors of the Federal Reserve and Economic Advisor to President Clinton, and he will share his insights on the fiscal outlook. And Bill Dudley, Senior Research Scholar at the Griswold Center for Economic Policy Studies and former President of the Federal Reserve Bank of New York. And Bill will share his perspectives on the monetary policy implications of the pandemic. Each of our presenters will open with approximately 10 minutes or so of comments, and then we'll turn to a general panel discussion, and that will be followed by your questions. You are welcome to submit questions at any time by clicking on the Zoom Q&A feature located just at the bottom of your Zoom window. And you can also upvote any questions you would like to see answered. We'll get to as many of your questions that time will allow. I should add that a full recording of the talk will be posted on the Griswold Center's website and next week on a Second Opinion podcast. And you can get that from Apple Podcasts, Spotify, YouTube, or wherever you listen to podcasts. So let's get kicked off. Many of us are still digesting what last week's elections mean for COVID-19 and the economy over the next few months, over next year, 2021 and beyond. But indications are that we'll have President Joe Biden presiding, and we'll come back to this again and again, I think, in our discussions, but probably presiding over a divided Congress. Of note, then President Biden could be the first president in 32 years to come into office without control of Congress. Huge implications. And he'll likely be confronted with an economy at a crossroads. We've got the positive vaccine news, which bringing all of us real hope for healing and for the economy. And then a gradual return to a new normalcy over a period of time, but facing the immediate reality of uncontrolled viral outbreaks reaching record, as we see today, crisis levels and further disrupting economic activity. And while we have the stock market, which is welcome to what some have said will be, and I put it in quote in my own mind, boring presidency as a result of congressional gridlock, it also means we're less likely to see the huge, the large, the multi-trillion-dollar relief packages that Democrats and states and many industries had hoped for. Today's presenters will shed some light on what the latest economic indicators mean, what we might expect from a Biden presidency, and how today's uncontrolled pandemic will influence policy and the economy going forward. So now let me turn to Professor Jessica Metcalf. Jessica.
Thank you. Can you see my slides?
Looks good.
Yes.
Great. Okay. So after a harrowing spring and a somewhat mixed summer, today it's estimated that over 1,000 people will die of COVID-19 in the United States. 2 to 3 weeks from now, that number will probably be over 2,000, not because transmission has accelerated, but simply because deaths lag cases, and that's how many cases are circulating in the United States today. We've learned a lot over the intervening months about what drives spread, from contact patterns to the context of contacts to immunity. Contact tracing, where an infected individual's contacts are identified and tested for the virus, has taught us a lot about the virus, for example, suggesting that if you share a household with an infected individual, your risk of infection ranges between 10 and 50%. Contact tracing also bolsters early suspicions that super spreading events were a really important part of the transmission of this virus, with barbecues, weddings, funerals, religious services, all well represented in contact tracing events. Although, of course, there's also the question of how biased these data are. Contact tracing, alongside experiments on the virus and on viral half-lives in different environments, have pointed to the importance of ventilation and also indicated that the virus doesn't like to be too hot and has a U-shaped relationship with humidity. The nature of the immune response is that it's going to take a while to learn about it, but we are accumulating information. For example, an outbreak on a fishing boat where everyone had been tested before setting to sea and was tested regularly while at sea suggests, among other lines of evidence, that previous exposure is likely to be protective, at least for a while, of reinfection. Of course, what we urgently need to know is what policies we should use to control spread. The Biden-Harris plan says that social distancing is not a light switch, it's a dial. In other words, a full lockdown is not the only option. My colleague Adam Kucharski puts it slightly differently. You can think of it as everywhere having a transmission budget, and you have to decide how to spend that budget. What do you want to keep open, and what are you willing to close? The essential challenge is knowing the costs and benefits of these actions. Even if you just focus on the impacts of the virus, this is surprisingly hard, in part because the data has been so strikingly sparse in the United States as a result of the paucity of testing, but also in general, but also because asymptomatic transmission and super spreading make the trajectory of this virus very unpredictable. So to establish which interventions work best, scientists have taken a bunch of approaches. One of them is retrospective modeling, and this is where you take aggregate counts of cases or deaths and map them back to data on interventions or on mobility or other features using known features of the infection, so the known underlying mechanisms. And there's been some extraordinary work in this realm. A recent paper in Nature suggested that restaurants were an important driver of transmission, and that perhaps lower income, the disproportionate burden borne by lower income individuals was in part because their points of contact tend to be more crowded. But the data from these estimates are also mixed. For example, different analyses have ended up saying that closing schools reduced transmission or closing schools had very little impact. And the reason is that these sources of analysis are unavoidably and inextricably linked to various sources of bias. So to illustrate that, we turn to one of my favorite dashboards, which is the dashboard for Switzerland, which shows alongside numbers of cases through times and the effective reproduction through times, which interventions were implemented when. So for example, in late February, they put in a ban of events of more than 1,000 people. They put in partial border closures a bit later, etc. And you can perhaps immediately see the problem. Many different interventions are changed at exactly the same time. So it's very hard to disentangle what different interventions are doing. This plays out through time. This is also likely to play out across space. Places that are similar for other reasons are likely to implement the same interventions at different times, at the same times. We could address these sorts of biases. We could use randomized controlled trials to pilot tightening or loosening interventions over short timeframes and compare treatment populations with control populations. And because the virus moves so fast, you'd only need to delay implementation in the control group by a couple of weeks to figure out what was going on. So in one county or one city, you might delay school reopening by a couple of weeks, and you'd be able to estimate quite clearly what the impact of that intervention was. And unfortunately, even though effectively these experiments are going on everywhere, because people are closing and opening things all the time erratically, no one has done them in a systematic way, so we still lack this sort of data. A final way that scientists have tried to tackle the question of which interventions work is by using scenario comparisons, so building mathematical models to try and explore the future of different decisions. I think people often assume that mathematical models will be used for forecasting, just as they're used to forecast the weather. I think that most communities I work with would not be using mathematical models to this end, in part because the disease's behavior depends entirely on our behavior. If you think you're predicting numbers of cases 2 to 3 months out, you're implying that you understand and can predict the decisions of politicians, the behavior of most individuals 2 to 3 months out, which is a rather intractable problem. What you can do instead is put together the logic of what we know about how the mechanisms underpinning the disease work, and then try kicking different parts to see what happens. So this illustration shows the example of a model that was trying to look at the problem of contact tracing. The size of the hump there indicates the magnitude of transmission, and the individual is isolated where the color of the hump turns from red to green. The second line, the second row in this plot indicates an infected contact of this person. And you can imagine there's various things you could improve in a test, trace, isolate program. You could improve how fast you found the contacts. You can improve how fast you found that initial person. You could improve how many individuals you tested to find those initial people. And we can explore the consequences of all of these different processes and where the largest returns of investment might be. For this or for any other process, data is key, and we need data on outcomes beyond cases and deaths. We need economic outcomes, we need psychological outcomes. You really need to understand the bigger picture. You can't do anything without data, and large-scale data collection alongside careful design would be fantastic and is still lacking. Even the data that exists is somehow not available in easy fashion. There must be tons of contact tracing going on in the United States. There's been very little publication around that. There have been some new suggestions of exciting interventions, such as inexpensive home tests, a bit like a pregnancy test from my colleague Michael Minna at Harvard, shielding by immune individuals. All of these may expand our options. But I think there's unlikely to be a silver bullet. Everyone wants a silver bullet. There's not going to be a silver bullet. I think combinations of interventions are going to be important. And we need to think about efforts that make it incredibly easy for people to conform. So it's clearly going to need collaboration across a whole suite of disciplines. And again, data is key. The first vaccine news is incredibly good. And this is an important piece on the benefit side of interventions. The scales have tilted. So the benefits of delaying your getting infected look even better, because it seems that it is at least quite tractable to make a vaccine. It's not a silver bullet though, it's going to take a while. We need to get through this winter first. So that's on the side of interventions. I think that the expression hindsight is 2020 is going to sound very different in the future, but it does behoove us to think beyond the kind of immediate term to the longer term. To this point, as we've thought about immunity and the trajectory of this virus, we tend to have bracketed individuals as being susceptible, infected, or recovered, or immune in some way, essentially, the recovered class. And we haven't thought too clearly about what this means, or we haven't explored the consequences of what this means. But you might be immune to infection, or you might not be immune to infection, but you might be immune to disease. So even though you got sick, the second time you got sick, you wouldn't be showing serious symptoms. So sick is the wrong word, in fact. We have evidence from the other coronaviruses that this is a possible trajectory. It might be that you get even more sick the second time. We can use models to explore this spectrum of possibilities simply by expanding on our basic SIR skeleton to look towards the future and think about, particularly in a world with a vaccine, what our landscape of immunity will look like. And we published recently on this with the group to try and identify and sort of calibrate what our understanding of our future trajectory of immunity will be. The top plot there shows the number of severe cases we expect under one particular scenario, and then the colored surfaces indicate the proportions of the population that will be in different immune brackets, naturally immune, susceptible, vaccine immune, etc. Our future does expand beyond COVID-19, and unfortunately all the other infections haven't gone away, or in fact, they kind of have gone away. Most of you probably haven't had a cold in a very long time. It's kind of wonderful, right? But and this plot shows exactly that. Every row is a different state in the United States. And after the dashed line, you can see that the numbers of cases is below the seasonal mean for influenza. This is great in a way, but it does have consequences. And it has consequences because the reason that there is an influenza outbreak every year is in part because the numbers of immune individuals has waned and are re-entering the population. So you have another outbreak. Those people are immunized and then the outbreak turns over, etc. So if you have a long period as shown in that gray bar when no one's getting infected, then the numbers of susceptible individuals, that's the top dashed line, can increase. And that means that as we move forwards, we might have a really massive flu season, perhaps in 2022, perhaps in another year. The exact details will depend on the details of the model and the details of our broader spectrum. I think the other thing to keep in mind is there will be another pandemic. This is not the last time this is going to happen, and we just need to be better prepared. Beyond all the obvious, like investing in public health, I think we need to be thinking about technological solutions that we could turn to this issue. And one of the ones I've been thinking about a lot with my colleague Brian Grenfell is about whether we can use the best sensor we have for infectious diseases, which is our own immune systems, to develop a global vision of what our landscape of immunity looks like. Using incredibly non-invasive samples these days, you can get a window onto all the infections you've previously been exposed to, which gives you a sense of which can spread, but also opens the way to improving vaccine design, to improving our understanding of immunity. And I think it would be foolish not to seize this opportunity to try and strengthen our abilities in all these areas. So there's a bunch of references, and I will share the slides, but that's what I had, so thank you.
Good, Jessica. Thank you so much. And I know a number of you have questions about what Jessica has both presented, also around the vaccines themselves, and we'll get to those here shortly. Now we'll turn to Alan Blinder to share his insights on the fiscal outlook. Alan.
Thank you very much, Senator. I'm going to, there it is. Everybody seeing that and hearing me?
You bet.
Okay, good. So I'm going to talk about the economy and especially about fiscal responses, but starting with the economy, if I can make my slide move, which so far I have not. Oh, there we go. Okay. So yes, happy Friday the 13th. As you all know, the pandemic is raging out of control right now. I made this graph, I don't remember, 3 or 4 days ago. We're probably up here now. It's just horrible. And this, of course, is taking a toll in human health and in deaths, but also on the economy in a variety of ways. I think the amazing thing, let me go back to that graph for a second. We had this what we thought then was a large peak in the summer, in July, August. We had our last briefing in this series, June the 9th. Then this happened. I thought, and it turned out to be wrong, that was going to put a bit of a dagger into the, well, bad metaphor. I don't mean kill the economy, but hurt the economy. Turns out not. And again, now, as far as we can tell, though it's early, the economy is not tanking in response to this latest and worst upsurge in anything remotely approaching what happened in March and April. So here are 2 graphs. This is the total number of jobs, payroll employment in the United States. Boom, down almost 15%. And now it's back, it's down now about between 6 and 7%. That's about 10 million jobs below where it was before the catastrophe hit. You don't see any hint of going back down again, at least not so far. The right-hand panel shows what's happened to real GDP. These are the numbers in trillions. And you can see a tremendous drop, 10% from the last quarter of last year to the second quarter of this year, then a very sharp rebound from the second quarter to the third quarter, which leaves us 3.5% below where we were before the roof caved in. Now, GDP only comes in quarterly. This comes in monthly. There are a few fragmentary things that come in with greater frequency that suggest things are slowing down now in November, but it's very, very fragmentary. So here's my question. We were quite sure in March, April that what was happening on the health front, which was terrible, but concentrated in a relatively small number of states, was going to hurt the economy badly, and it did. But the last wave, and at least so far, this wave doesn't seem to be doing that. So I want to give you some speculations. They all got question marks after them. I'm going to run down these quickly because they are question marks more than answers. One obvious thing is that we haven't had lockdowns on this round as we did in the March, April timeframe. I think that's wrong, and let me show you a graph. I showed this to my students in Economics 101. Let's just look at all the panels except residential, that is stay at home, look the same basically. And what this shows you with Google mobility data, so this is very fine in terms of time, is the path of the decline, in this case, in retail and recreational activity, sharp here, and in red, the imposition of lockdowns, shutdowns of various sorts by governments. And what this shows you is that people were withdrawing way before the government started shutting things down. People stopped going shopping, they stopped going to the movies, they stopped going to sporting events, so they stopped going to work, they stopped traveling, all in advance of the lockdowns. So I think the notion that because we don't have lockdowns this time, that's why economic activity doesn't seem to be impaired, at least as of yet, is probably not right, because it was people's own individual decisions that did the first one. Second is, which I think there's probably more truth to, is this is an old cliche, familiarity breeds contempt. We don't want to finish with contempt. It's just that you get used to it. Things are by any objective standard much worse now than they were in March, April. But I think a lot of people are more frightened in March, April than they are now because they've gotten used to it. Remember, all of these have question marks. I'm not sure any of this is right. Third possibility is just quarantine fatigue. You all remember that movie, oh, I can't remember the name, with the newsman, I'm sick and tired, I'm not going to take it anymore. I think you see a lot of that attitude around the country, and people don't want to be quarantining any longer. A better reason, maybe, Jess touched on this, is that there has been some improvement in the medical treatment of this disease, even short of a vaccine or even short of a serious therapeutic. Just doctors are learning how to treat it better so that the death rate, that is deaths per case, has gone down, and that makes it less fearsome. People are more afraid of dying than they are of getting a terrible flu. Then there is the president and Fox that are telling everybody there's no such thing, it's a hoax, don't worry about it, don't let it dominate your life. It's sad to say, but I think some people have listened to that. But the bottom line, literally on this slide, is despite all of these, quote, reasons, I'm still surprised that we haven't paid a bigger economic toll yet for the resurgence of the virus. So let me now turn to the usual suspects if you want to mount a rescue operation for the macro economy, you turn to monetary policy and you turn to fiscal policy. Normally, in this one, of course, you also turn to public health, but that was sort of covered by Jess, and I'm not going to go there. So let's start with monetary policy, where the question is, what have you done for me lately? And the answer is not much. That's not a criticism of Jerome Powell, by the way. In fact, the Federal Reserve did an enormous amount, and amazingly quickly. I think if you've never been close to the Federal Reserve, and as Bill Frist mentioned, I was once the vice chair of the Federal Reserve, you can't get your arms around how the speed of response of the Fed deviated from norms. The Fed is usually a very slow-moving institution, and it moved in days and got everything done more or less within a few months. It was an amazing display of seriousness of purpose and ability to do things quickly. That's the good news. The bad news, and I'm deferring this to Bill Dudley's presentation next, is the Fed doesn't have many bullets left in its ammo box. It's shot almost everything. Now, almost. I'll come to the almost very briefly in a second. That, of course, is why Jay Powell is practically begging the Congress to take fiscal action. I'm going to come to fiscal action at greater length shortly. He knows that there's not much that the Fed can still do. That said, if Congress fails, and I'm going to talk about that shortly, Congress fails are a natural conjunction of a noun and a verb. Congress fails. If they do, the Fed is going to have to step up and do something more to avert a total economic catastrophe. And again, I'm going to defer to Bill what else they might do, except to say that what it's got left in its ammo box is not very powerful. I'm sure Bill will not disagree with that. All right, fiscal policy is probably more promising. Everybody on earth wants to call this fiscal stimulus, it seems. This is not stimulus. This is relief, like what we do after a hurricane or a tornado or wildfires in California or something like that. That's what this is really about. The CARES Act, which Congress passed very quickly in March of this year, was an enormous bill. Here are two metrics to put that into perspective. The amount of spending was about 11% of GDP just in that bill, which is an amazing number. Some of us are old enough to remember when 700 billion for the TARP was considered holy mackerel. How could we even think of a number like that? The CARES Act was about triple that. Another metric, which to me was very meaningful when it passed, is the spending in the CARES Act was equal to roughly 50% of all federal spending in the previous fiscal year. So this was very, very big and very much needed. So it was big and it was sloppy. There were lots of things done wrong. Congress was legislating really, really fast. But making it big and doing it quickly were the important things, and the Congress did step up to the plate back then. That was then, and this is now. Most of the spending in the CARES Act is already out. It's about the past, not about the future. And this is a by the way. There's a moratorium, a recommended, not legal, a recommended moratorium on evictions. That's going to end on December 31st. So this is another problem that we haven't been facing up to very much now, but the prospect of putting a lot of people out on the street is a frightening prospect. Now, there's been a quote debate. I put this in quotes over what I'll call here CARES 2. That's just my nomenclature. That has allegedly been going on since May, when the House passed what Nancy Pelosi named the HEROES Act. This is why I put debate and going on in quotes. You could just look at that man's face and you get an idea of how well the debate has been going. You all recognize that man. So I want to pose the question, what if anything is going to happen during the transition? And that's important because waiting for a bill until February, right? Joe Biden becomes president of the United States January 20th. It's almost February. First, you have to figure out how to work the phones and things like that. So if we don't do it in the transition, CARES 2 is not happening until February, if indeed it does. And that's just a terrible idea given the way the pandemic is raging. So this next slide, and I'm almost finished, is why Mr. McConnell may want to pass a skinny deal in the lame duck session. This is inside the Beltway talk. Everybody's inside the Beltway is talking about a skinny deal. Skinny tends to mean ballpark $500 billion, 500 billion. I'm laughing again. We used to think of that as a lot of money. Now it looks puny compared to the sums that we're talking about. So I want to explore with you some reasons why this may happen. I want to preface that by saying very clearly, I am not predicting what will happen. I don't believe I can get inside this gentleman's head and figure out what he thinks is in his best interest. So here are some reasons why he might. One is that he's genuinely worried about blowing up the deficit. And my comment on that is don't be ridiculous. We have seen the behavior of the Republican senators on that matter since the beginning of the Trump administration and earlier. And that's a hypothesis we can completely reject. A more serious one is he'd like to avoid a bigger package in the new Congress that is looking to a Biden presidency and at least some uncertainty about whether the Republicans will be in control of the Senate. I don't think it's much, but probably some. He might be thinking, let me take a skinny package now rather than winding up with a fat package in the early weeks of the Biden administration. A more likely one, I think, is that he wants to do what he can to help those two senators that are in runoffs in Georgia win those runoffs so that he can remain majority leader rather than minority leader. We have on this Zoom a former majority leader who I think can tell you it's a lot better to be a majority leader than a minority leader. And Mitch McConnell is not looking forward to being a minority leader. So I'm sure he's thinking about what could be put into this skinny package that would be good for the Georgians. And I want to point out something, Jess sort of alluded to this, but didn't hit it very hard. The very good news on the vaccine front, so the Pfizer one made the big splash, but there's other good news on the vaccine front, is not a reason to say, okay, now we don't need another fiscal relief program, because this is just not going to happen fast enough for many, many reasons. An important one, which has been mentioned, but I think not emphasized, is if the Pfizer vaccine is the one that's available first, the refrigeration requirements for this are incredible. And I mean that, like not believable. They go well beyond the capability of basically every hospital in America to keep this, store this at the requisite, I'm thinking it's minus 90 Fahrenheit or something like that. Very, very cold, very cold. And that's just one reason, but an important one. All right, finally, I want to finish because there are always questions about the rising government debt. I talked about a CARES 1 being 2.2 trillion, CARES 2 being who knows if we get it. And in general, the federal debt is growing very, very fast. What we've shown is something that I think a lot of us suspected, but we didn't know for sure until you put it to the test. This is like a stress test, that the US government can sell a lot of debt without raising interest rates very much. And importantly, I put this in parentheses within the commas. This is important. It's not just the amount of debt we have already sold, but the expectations that we're going to be selling a lot more, we, the US federal government. Markets look ahead and they can see a lot more debt being issued by the federal government, and yet we're not paying a price in terms of higher interest rates. So far we're passing that stress test very well. Incidentally, when we did this June briefing, I said at the time that the Fed had bought almost all of the newly issued debt by the federal government. That was in June. It's not true anymore. It's now about half. I looked at the numbers recently. The Fed has acquired about half of the debt that the government has issued since February, not 100%. So we're selling it into the markets pretty easily. The appetite for US Treasury debt in world markets looks to be gigantic, but probably not infinite. And that's the question here. It's gigantic. We can certainly push further down that line without paying an interest rate cost, but there's probably, I almost said a limit. I don't mean a hard wall, but you gradually start having to pay more to float the debt. And we're probably going to be doing this for some time. So my guess is that we can go quite a bit longer along this road. And my second guess is we're going to find out how much further we can go along this road. Thank you.
Alan, thank you. going third has the advantage. You can start putting some of this together for us. Bill, Dudley, a little bit on your perspectives on the monetary policy implications, and feel free to start linking some of this together, which we'll do back in the discussion.
Okay, great. Thank you. Well, I'm going to focus on monetary policy, where we are today and how we got here, and most importantly, where do we go from here? As Alan mentioned, the U.S. monetary policy response to this pandemic was unprecedented in three respects: speed, breadth, and intensity. As Alan mentioned, the Fed has never responded this fast. If you look at the great financial crisis that started in August 2007, the Fed didn't get to negative interest rates until the fall of 2008. March 11th, the World Health Organization declared the coronavirus a global pandemic. March 15th, 4 days later, the Fed cut short-term interest rates to zero. And in a few short weeks after that, they began to purchase hundreds of billions of dollars of treasuries and agency mortgage-backed securities, and introduced a host of a broad array of special liquidity facilities that went beyond what they had done during the great financial crisis. So not just coming back with aid for money market mutual funds and the commercial paper market and the asset-backed securities market, but they also introduced new facilities to backstop the corporate bond market, the municipal bond market, and they brought back some of their old hits, dollar swap auctions with foreign central banks, to make sure that foreign banks could get access to dollar funding so that they could continue to fund their dollar assets. And I have to say, with the exception of the Main Street lending facility, which hasn't been very effective, it mostly worked. The Fed pushed down short and long-term rates dramatically. They restored market function. All the markets that weren't working very well in March and April are working fine today. Companies have access to the stock market, to the corporate bond market. Municipalities can raise debt as well. And we've seen this all has been remarkably pushed the stock market up to a very high level, especially given the degree of uncertainty that we have about the outlook going forward. In the late summer and fall, the Fed introduced another innovation that I think is actually quite important. This has been something that had been underway for quite a while. They were reviewing their long-term monetary policy framework, and they announced where they landed in late summer. And they basically said they're making a change that seems small on paper, but it actually has some pretty significant consequences for current monetary policy. They basically said we're no longer going to target 2% inflation. In other words, all the time try to hit 2% inflation. We're now going to try to target 2% inflation on average. Well, that sounds like a very subtle difference, but when you've been missing inflation to the downside for many years, what the consequence of that is inflation expectations start to become unanchored to the downside. That tightens monetary policy, and that makes monetary policy less effective. So the Federal Reserve committed to 2% inflation on average. That means that if we're underperforming 2% for a while, then we're going to have to be above 2% inflation for a while to make up for those shortfalls. And so that's all nice and good. Doesn't really, you wouldn't think that that has any near-term implications for policy, because you can't hit 2% now. What does it mean about hitting 2% inflation on average? But it actually was quite significant, because if you look at what happened at the September FOMC meeting, the Federal Reserve took this new policy and translated that in terms of what their forward guidance is, in terms of how long they're going to keep short-term interest rates low. Before, they were going to keep short-term interest rates low for a while to make sure that inflation got back to 2%. But the idea was basically, when you got back to 2% inflation, you'd want to have monetary policy at neutral at the same time. Now they said that they're going to keep short-term interest rates at zero until three conditions are met. The Fed is comfortable that we're at maximum sustainable employment, that we've hit 2% inflation, so not a forecast, so we've actually had to hit 2% inflation, and that the Fed expects that inflation will rise above 2% for some period of time. Now, this has some pretty important implications for monetary policy. Before, the Fed wanted to arrive at a neutral monetary policy just about the same time when the Fed arrived at full employment. So if everything worked out really well, you'd be at full employment, you'd be at 2% inflation, and you'd be at a neutral monetary policy. Under the new regime, the Fed is not going to tighten monetary policy when we get to, we're not going to get to a neutral monetary policy when we get to full employment, because only then are we going to start to see inflation start to approach 2%. And the Fed has said they want inflation to rise above 2% before they start to tighten monetary policy. So this has a couple of implications. First of all, it means the Fed is not going to tighten monetary policy for a very long time. It's going to take a while for the economy to get back to full employment. It's going to take a while for the economy to push beyond full employment. And that's what's going to be necessary to push inflation above 2%. The second implication is that monetary policy is now going to be more stop-start. So once the Fed gets to full employment and beyond full employment, inflation rises above 2%, the Fed's going to have to slam on the brakes. And so they're going to have to tighten monetary policy by more. They're going to tighten monetary policy by more because they're going to have to push the unemployment rate back up to its maximum sustainable rate. And they're going to have to tighten monetary policy by more because inflation is actually going to be higher. And so nominal interest rates will have to be higher to keep monetary policy tight enough to slow the economy down. The consequence of this is that recession risks are actually going to increase under the new regime. Prospect of a soft landing in this regime is very, very low because the Federal Reserve will be late to tighten monetary policy. If you look at the United States historically since World War II, the Fed has had great difficulty engineering soft landings. It's very hard for the Fed to push up the unemployment rate a couple tenths of a percentage point. Whenever they start to push the unemployment rate up by more than that, we've always ended up in a full-blown recession. So the policy changes were good in the sense that they harden the anchor on inflation expectations. They make the forward guidance longer term in nature. The markets are now convinced the Fed will keep short-term interest rates low for longer, and that provides stimulus to the economy today. But it does mean that down the road, there will be a downside to this. We'll probably have a little bit more volatility in terms of monetary policy in the economy. So where does monetary policy go from here? Well, as Alan said, the Fed could do more. The Fed could buy assets, treasuries, and mortgage-backed securities at a faster rate. They could shift their purchases to longer maturity assets. Right now, they're buying treasury securities across the yield curve, but they could say, no, we're not going to buy any bills or short-term treasury notes. We're going to concentrate our purchases in 5-year treasuries, 10-year treasuries, and 30-year treasuries. Another possibility is they could do yield curve control. The Fed could commit to keeping the 10-year bond yield at a particularly low level of yields and basically say to market participants, we'll buy as many securities as we need to buy to keep 10-year treasury rates from rising above, say, 0.5%. They also could cut interest rates into negative territory. I very much think they're not going to do this because not too long ago, the Federal Open Market Committee minutes revealed that all FOMC participants were opposed to pushing US interest rates into negative territory. But this really, I think, misses the more important point. Even if the Fed did do more, even if they did buy more assets, bought more longer term assets, did yield curve control, or even cut short-term interest rates into negative territory, I think the effects at this point on the economy would be very modest. And the reason why they would be modest is because the Federal Reserve has actually already been successful in terms of their monetary policy program. Interest rates are already extraordinarily low. The 10-year Treasury note yield is less than 1%. The interest rate sensitive sectors of the economy have bounced back quite strongly, probably more strongly than what we expected earlier this year. The auto sector, the housing sector is really basically back to where it was before the pandemic started. And financial conditions are extremely accommodative, especially in light of the economic environment. Markets are accessible, people can raise money, and stock prices, as we've seen, are very high. So I think the issue on monetary policy isn't that whether the Fed can do more, they can, but the problem is that even if they did do more, it wouldn't have much consequence for the economic trajectory. And as Alan noted, this is the Fed officials do recognize this. They're never going to say that they're out of ammunition because that's scary, but they do recognize this, and this is why they're making the case for further fiscal stimulus. it's unusual for the Fed to opine about what Congress and the administration should do in terms of economic policy. The Fed usually sort of keeps to its monetary policy knitting. But the fact that they're talking about the need for fiscal stimulus is a de facto admission on their part that monetary policy hasn't quite reached its limits, but certainly we're in the area of rapidly diminishing returns from further monetary policy stimulus. I'll leave it there.
Good, Bill, thank you. And at this point, we're going to turn to our open discussion. And I would love it if any of you would like to comment on what each of you have put forward. And then our Q&A portion of our event. If you haven't already, remember, you can submit your questions by clicking on the Zoom Q&A feature at the bottom. And we have a whole bunch of questions that have been put on the table. Bill, let me open. I'll be picking some of the questions that have been submitted. What about a Biden presidency? Go ahead and let's put your looking into the crystal ball. As you look forward, are there any implications of a Biden presidency for the leadership of the Fed?
Oh, sure, there absolutely are. I mean, Jay Powell's term ends at the end of January 2022, so he has 15 more months on the job, and he certainly could be replaced if the Biden administration decided to do that. I mean, there's precedence on both sides here. Janet Yellen was not reappointed by President Trump, but Paul Volcker was reappointed by Ronald Reagan, and Ben Bernanke was reappointed by President Obama, even when the political parties in the White House changed. So I think it could go. I think it's up in the air. I don't think it's going to change though what the Fed does in the very near term. Probably the biggest change that's going to occur at the Fed will probably be. I would be surprised if the Democratic Congress was willing to extend Randy Quarles' term as vice chair of supervision for another term, because I think there's a view among the Democrats in Congress that he's been chipping away at bank regulation, making it a little bit looser. And I would imagine that the Democrats are probably not so happy about that. The biggest development in the Fed over the near term is it looks like the U.S. Senate is going to push forward and try to get Judy Shelton and Christopher Waller confirmed, and to the two open governor seats on the Fed. And that's quite important, right? Because if they fill those seats, then there aren't any openings on the Board of Governors. And so then Joe Biden won't have anybody that they can put into to the Board of Governors. And that will constrain his flexibility a little bit. But I think, the Fed is really committed to this new monetary policy framework. They've made a commitment in terms of their statements to keeping interest rates low for a long period of time. So I don't really think that that's going to change regardless of who we have at the very top of the Fed.
Thank you, Bill. Jessica, we got a whole bunch of questions on the vaccine, and obviously bringing a lot of hope, a underscoring of the importance of science and this whole warp speed with which we really have developed as a nation and really as a global community of vaccine in record time. It used to be 10 years, and now we're down to months developing the vaccine. The distribution is what we're going to all be facing here in the next several months. Our policymakers are. It'll affect everybody listening to us or watching us today. And much of our vaccine delivery infrastructure has been currently today geared towards kids and towards children. Are there things that we should be planning for in considering the overall distribution? You might outline what it is now, but are there other things that you think we actually should be considering as we distribute what we know, at least initially, will be a limited number of vaccines?
Absolutely. So I work a lot on rubella in peacetime, as one might say, which is to address an issue which really only affects women of childbearing age, because the major issue is to do with infection during pregnancy. And yet most of global policy is designed towards getting the rubella vaccine into children, and which surprised me to start with, but it just reflects this fact that children are perceived as being relatively easy to find within a global context. In places like the United States, influenza vaccine is one that you certainly distribute to adults. And so we do have the infrastructure in place to start thinking about that. And influenza is also something where the most severe outcomes are associated with the elderly. So in some ways, we have a template to start thinking about how we might distribute those vaccines, there will certainly be some really interesting considerations of what the optimal allocation is in the context of considering both the most vulnerable, but also healthcare workers. But the really key issue there is, I think absolutely we wish to protect our healthcare workers. We don't know for this current vaccine whether it stops transmission. It could be that it's only stopping symptoms. The measurement of the outcome for the Pfizer vaccine was just whether you were symptomatic and producing and had a positive viral test, which is great. It's a really great place to start, but it could very well be that those people are still capable of transmitting infection, which slightly changes the calculus on how important it is to get this into people who are on the front lines of healthcare.
The Pfizer is one of many vaccines, and in truth, there probably 6 months from now, there will be several vaccines that people will have to either choose from or that will be recommended. Any thoughts on that? Because that also is a new wrinkle that not only is it the adult versus children, with this emphasis on adults, but also the distribution of multiple vaccines, which, as we talked about earlier in the program, the initial one has to be stored at very cold temperature. There are 2 doses. How are we going to do that, or how do you see it playing out over the next 6 months?
So Alan raised the issue for this current one, right, which is that it has to be kept so incredibly cold that we just, even for things which require cold chains, nothing requires a cold chain like that. It's excellent, I think, that we have a diversity of vaccines, and we might end up shifting towards different vaccines in different settings. And there might be different efficacy in different age groups. There might be different ways in which it plays out. I think that we're still at the beginning of this vaccine discovery trajectory. It's extraordinarily positive news that the signs are there. We still don't, the trial is run at 3 months. We don't know that it induces long-lasting immunity yet. And so, although it is very suggestive that it is at least possible to create vaccines for these viruses, I think we're going to learn an awful lot more. And it's great that we have, a lot of different, we don't have all our eggs in one basket.
This is SARS-2. There was a SARS-1 18 years ago. SARS-1 disappeared. It went away, and people said why. It was because it was more lethal. It killed. My question is, and this one kills terribly, but not as lethal, is SARS-2 going to be around forever? 5 years from now, will we have to be immunized over time? Is this a virus that will ever go away? Or is this virus just like we come back to our animal flu virus, are we gonna have to be immunized every year or every 2 years? Will it ever go away?
This is a really great question, Senator Frith. And I think that the path to answering that question is in part towards the end of what I was talking about before. If it is the case that a secondary infection is mild, and it is the case that children have very mild infections, we're going to move into a world where the infection is endemic and not manifesting as particularly severe and particularly virulent. I think how we walk towards that future, I think it's very unlikely that we will eliminate this virus. It's very hard to eliminate viruses. We have eliminated exactly one, that was smallpox. It had no real asymptomatic transmission, and it was at a different time in a differently connected world. In a world without HIV, it just was a much, I think it was a more attractable environment in which to do that. So my suspicion is, and there are people who disagree with me, that we will be living with this virus forever, but I think it will be a different animal. But it's just because most of us will have seen it once, or will hopefully have been vaccinated. And therefore, the second time around, if, depending on the biology, there's a lot of biology we still need to learn. But that's not inconsistent with other coronaviruses.
Thank you. And again, we have a number of questions. We'll come back to that. Alan, you talked about the debt GDP ratio and not paying a price. And I found it really interesting, when we'll pay a price. And when I came to the Senate in 1994, everything was deficit, at least on the Republican side, was deficit and debt. And then a little bit later, you had Dick Cheney say, deficits don't matter. Where are we today in terms of, was Cheney right?
I think Cheney was more right than wrong. I hate to say that, actually. It does depend a bit on the reason. So I'm just speaking abstractly. I think very few economists would be worried about deficit spending to pay for infrastructure, deficit spending to pay for climate mitigation, climate change mitigation, and now deficit spending to end the pandemic that might sicken and kill many, many people. A lot of us still want to draw the line on deficit spending to finance frivolous spending. That's my way of putting it. Others would say to bolster the incentives of rich people to work hard and invest well. I mean, those two are keenly related to one another, and you're well aware of the political debate over that. But I think what I emphasized in the one slide is that a lot of us might have worried about boosting the debt to GDP ratio by 30, 40 percentage points in a short time. Could you shoot out that much debt into the world capital markets in a short time? We now know the answer to that. It's yes. It does help a bit when the world's investors are a bit freaked out and seeking safety. So in that kind of a investment environment, U.S. Treasuries, also Swiss bonds and things like that, are even more attractive as assets than they normally are. So that's probably helped a little bit. But I think the basic point, and I just want to mention one, the basic point is that we've shot out a lot of debt, and it looks better than a lot of people might have thought. I do want to emphasize that point that I mentioned, that it's not just the debt we've already sold. Everybody in financial markets knows there's going to be a lot more deficit spending by the US government, a lot more federal debt being sold. And that forward-looking markets incorporate that in pricing. So that's as the market people like to say, that's priced in to these markets, which makes me even more confident that we can go higher. It's priced in that we will go higher.
Bill, what in the whole deficit debt, and respond a little bit to what Alan said, and then also just elaborate a little bit more on how we should think of deficit and debt today, where it clearly is going to be escalated for good reason.
I think the big issue right now on debt is that the interest rates are so low, and so debt service costs are so benign. I mean, we basically tripled the amount of debt outstanding in the last 12 years, and debt service costs haven't budged at all. That's because interest rates have come down, very dramatically. Where this starts to sort of unwind is 3 or 4 years down the road, when the Federal Reserve starts to tighten monetary policy, interest rates rise. And then not only do we have this accumulated debt, we have a much bigger interest bill on that debt than we ever had before. And I think at that point in time, it's really going to depend on how foreign investors look at us. If they have confidence that we're going to be able to manage this over the medium to longer term, then we'll continue to get the money from abroad. But the United States is unusual. We really do depend on the kindness of strangers. We need to finance a good portion of our funding by foreign investors moving money from their countries to our countries and to invest in our financial markets. And so if we don't maintain their confidence, then the road would get a lot more bumpy.
Bill, Alan had said that what we're looking at possibly in the lame duck or coming back is really not stimulus, but more relief than stimulus. Do you agree with that, and explain why a little bit? Then Alan, I'll come back to you.
I mean, I think that the words don't mean that much difference. I think what Alan's trying to get at is the stimulus isn't going to propel the economy upward dramatically. The stimulus is going to the funds are going to keep the economy from sinking. So you're basically sort of underpinning the economy in a way that keeps it from contracting more significantly. In terms of Alan's remarks, I agree with almost everything he said. I would be a little bit more cautious though about taking a lot of positive from the fact that the economic news up to now has been reasonably good. The pandemic's only accelerated very dramatically in the last 4 or 5 weeks, and so most of the economic news that we're getting reflects where we were a month ago, rather than, as opposed to where we are today. So I think that, the social distancing, will probably, if at the margin, I think will certainly increase. I would expect people will be a little bit more cautious. I would imagine the states will bring back some more, more greater restrictions than we have today. And so I really do expect if the economy continues to recover, it's going to be at a much, much slower rate. And depending on where the pandemic goes, there really is some risk of the economy actually starting to turn down again. But that really depends on the pandemic and how much people social distance and how state governments react in terms of what they put in place in terms of mandated shutdowns.
Good. Alan, Jessica, I'm going to come to you in just a second I got a question on this 90% efficacy of the virus. And I think it's worth it because we're going to, of the vaccine, I think it's worth coming to that because we're going to have other vaccines here in the next few months, what that means. But Alan, any other final comment or elaboration on?
No, just to say, I agree with what Bill said. And what I was pointing out to mainly was the surprise I had actually that the summer surge, which was to a much higher peak and more widespread geographically than the spring surge, didn't knock the economy off its blocks, which I was afraid it was going to. This one is very, very young, and we will see. But the reason I was highlighting it was exactly what Bill said, that this is, in addition to imperiling life and limb, this is imperiling the economy.
Thank you. Jessica, the vaccine, it was interesting, and this came out in just this week in a press report, which is unusual for science. Science usually comes out through peer-reviewed journals or from objective bodies, but it came out from the company itself. And I should point out that Pfizer has not taken government money, and they're doing this on their own. In large part, I'm sure it's to escape the burdensome aspects of the regulatory burden. I don't know, and I'm not affiliated with Pfizer at all. But it does leave people going very carefully through that press release. And part of it was it works with this 90% efficacy. I'm not sure exactly what the language, but explain that a little bit. As I said earlier, we're going to see lots of other vaccines coming out, which is a great thing. But what does that mean?
So I may not have the details exactly right, but this was a huge trial. So 40,000 individuals enrolled. And what you do in these sorts of trials is sort of what I was suggesting to try and understand the different interventions were put in place, which is where you have a control group and a treatment group. And the control group will have been given a placebo vaccine. They won't have known what they were given, whether it was the true vaccine or a placebo. And the treatment group was given the vaccine. Of those 40,000 people, at this stage, 94 have become infected. And that was over the threshold for the number that they had pre-registered as the number at which they would first report. It's often really hard to trial vaccines because by the time you get around to making a vaccine, there are very few cases. So the one silver lining about right now is that that is not a problem. 94 sounds like a small number, but it's still quite a large number. And with 90% efficacy, what that implies is that there were probably around 9 of the cases, 9 people presented with symptoms and tested positive for the virus in the control group, in the treatment group, and 85 presented with symptoms and positive in the placebo group. And from that, you conclude that this vaccine is 90% efficacious. Obviously, these are good numbers. These are really good numbers. These are small numbers, though still, but often these are the sorts of numbers around which such vaccines are developed. And just to reemphasize the point I made earlier, they were only testing people who presented with symptoms. So we don't know whether, if there might be huge numbers of individuals who are vaccinated who were still infected, maybe still capable of transmitting, but not showing symptoms, which would also be great. I mean, that would also be a really good thing. But it's worth keeping in mind as we go forwards, to be close to being able to eliminate an infection, you need an incredibly efficacious vaccine that stops transmission. But it's still good news. It's great news. And it's one more point, it's 3 months out. So we don't know how long that lasts beyond those 3 months.
Yeah, the whole anti-vax movement, it's down to where today probably less than 50% of people say they want or take the vaccine, and that may change over time, but it's been getting lower and lower, which is a little bit frightening because as we think of what has been known to herd immunity, it's natural infection and it's vaccination. I mentioned that only because this is a new vaccine, this particular one with Pfizer. It's what's called an mRNA or messenger RNA vaccine, which makes it very exciting. This is the first time it's been used in humans, and we don't need to get into the science of it. But should people be afraid of that at all because it's mRNA? And then what are the advantages of that other than the fact that you can move a lot faster and you can probably produce it a lot faster?
Surely the science is what's exciting. So you're absolutely right. It's a new technology and it's very exciting. It's kind of beautifully simple in a way because mRNA is sort of like giving your body a lookup table to build a protein, which looks like the virus. And then your immune system sees that protein and goes, oh, that doesn't look good, and learns to respond to it. So, just as all vaccines are designed to turn your immune system, to alert your immune system to the presence of a pathogen, this is doing exactly that. And it's doing that in a kind of incredibly, sort of elegantly simple way. So for example, the Oxford vaccine is using a virus, an existing virus that has very few, sort of no effects, and slipping the spike protein into that. So that's another way in which you could imagine you get a response. Should we be alarmed? I mean, all of the logic of thinking through how it works doesn't suggest obvious causes for concern. Then again, we haven't tried it yet, right? But it's something, it's very natural. It's giving your body a lookup table for a protein that doesn't do very much, except alert your immune system, make your immune system mildly paranoid, hopefully in a good way.
Yeah. It is tremendously exciting. It is new science, and to have such positive results, I think, as most of our listeners know, we were looking for this 50% efficacy, and it came back 90%. Even if you don't know anything about it, that's good, and it's remarkably good in terms of the science. Bill, let me come back to you, and this is going to sound like it's sort of a little bit off the mark, but it really kind of comes back to it, and you can sort of help me with it. The Dodd-Frank Act, did all of the changes that were implemented by the Dodd-Frank Act work in making the banking system more robust and more resilient? And I guess, let me take it just one step further. How will bank regulatory policy, again, looking in the crystal ball so we don't know, but likely change under a Biden presidency?
Okay, so we've had a pretty big stress test, in terms of the economy, in terms of the pressure on banks. And I think the banks have come through that stress test quite well. If you remember, post the great financial crisis, a whole bunch of regulations for banks were toughened. They had tougher liquidity requirements, capital stress tests. And I think, and so we've come through this period and people still trust banks. They haven't pulled back in terms of their willingness to do business with banks. That's far different than where we were in the fall of 2008. Where trust within the financial system broke down completely. So I think the banking reforms related that followed the great financial crisis have been largely successful. And I think the conclusion from that is, let's keep them in place. I think where we've been less successful is in the non-bank part of the financial system. And you can see that by all the interventions, the special interventions the Fed had to do to rescue the treasury market, the rescue of the agency mortgage-backed securities market, to bail out the money market funds, to backstop the commercial paper market. All those things, it's sort of like, here we go again. And I think the lesson here is that the Dodd-Frank Act didn't do what it needed to do in terms of addressing financial stability risks that arise outside of the core banking system. They established the Financial Stability Oversight Council, and the Financial Stability Oversight Council was supposed to do that. They were supposed to designate important non-bank financial institutions as systemic. They did designate 4 of them, but those firms are now de-designated, and there's exactly 0 firms that are viewed as systemic from a non-bank financial sector. The Financial Stability Oversight Council was also supposed to designate activities as systemic. Well, some of these activities that the Fed intervened for obviously were systemic, or the Federal Reserve wouldn't have had to do these interventions. So I think the Financial Stability Oversight Council has just not worked very well in terms of really addressing the financial stability risks outside of the core banking system. And there's some simple reasons for that. One, it's chaired by the Secretary of Treasury, so it's politicized, so the executive branch has control. And 2, the members of the Financial Stability Oversight Council, like the SEC, the CFTC, the Fed, the FDIC, and so on, in some ways don't really want the FSOC to be very powerful, because if the FSOC is powerful, it's going to limit the authority of these individual agencies. So in some ways, the agencies don't really want the Financial Stability Oversight Council to have a lot of power. So I think that post this pandemic, I think we'll have a big look at the non-bank financial sector and what can we do to make non-bank financial sector more robust and resilient. So we don't need the Fed to do these sort of emergency interventions, which I think are a mark of the fact that we're not really where we want to be in this area.
I'd like to pipe in 15 seconds on that. There's this old cliche, personnel is policy. One thing that will change with the Biden presidency is the names of the heads of all the regulatory agencies, except the Federal Reserve, where Jay Powell will remain in charge. And those other folks are basically deregulatory regulators. And we're going to have much more regulatory regulators. Now, that has pluses and minuses, but to my mind, it has a lot of pluses. It was the deregulatory regulators of the W. Bush administration that helped get us into the soup that we got into. Wasn't the only reason, but it was a contributing factor. And they're going the nature of those people is going to change, even if you don't change the law.
Good.
Ideally, you don't want the needle, though, to be swinging back and forth as you go from administration to administration. So
that would be nice.
I would argue you need a better structure to sort of have consistency in terms of policy over time.
Bill's more optimistic than I am.
Go ahead, Alan. Alan?
I said Bill's more optimistic on that score than I am.
Okay, that's good. I like it. I like it.
Administrations, and we get presidents with very different attitudes.
Let me do the next impossible. We have about 15 more minutes, and what I'd like to do, we've got lots of questions. I've been taking questions off the panel, but I'm going to sort of limit our answers to about a minute for each one to get to as many more that we can over the 15 minutes. It's always frustrating to do that. On the other hand, we've got huge participation for, scores and scores, hundreds of people out there. So let me go quickly, and we'll try to limit it to a minute. Obviously, I'm exaggerating a bit. Tom Byrne. Can the Fed control 10-year rates as easily as short-term rates, or might all this borrowing lead to a steepening of the yield curve?
Well, the Fed definitely could control 10-year rates if they really put their mind to it. I mean, the Bank of Japan has done just that for 10-year JGB yields. The Fed would just have to say, we're prepared to buy whatever it takes to keep the rates at the level that we've set. That's the good news. That's the good part of the story. The bad part of the story is that all works fine until the economy recovers and the Federal Reserve has to sort of pull back from that commitment. And that pulling back from that commitment is not an easy thing. We saw this in Switzerland a number of years ago, where the Swiss franc was pegged to the euro, and all of a sudden they decided that they didn't want that peg anymore. And it was a pretty violent breakup. So the yield curve control idea would definitely work. It's easy getting in, but it's a lot more difficult exiting. And that's really why the Federal Reserve has been holding off and not pursuing yield curve control at this point.
Good, thank you. Jessica, Torsten Slock, what are the health policy lessons from the pandemic? Obviously can't go through all of them, but are the lockdowns we're seeing in Europe today a best practice, or can we learn from the way that China has been dealing with the virus? Again, very general sorts of questions, but in the policy, what can we learn from other countries? Are we actually assimilating those into what we're doing today?
I think there's a lot to learn. And one of the things that people keep failing to learn over and over again is that early action is good. I think nobody wants a lockdown, and it would be better if we could be much more targeted in our response. Test, trace, isolate systems. And one of the things that the Japanese public health community has been doing very successfully that I noticed came up in the chat is backward contact tracing. So where you go back to try and figure out what the clusters are. And if they're driving transmission, then you're in a really good place. The problem is that once it's out of hand, your test, trace, isolate system just can't manage anymore because there's just too many cases to be identified, you're tracing them too slowly, et cetera, et cetera. I think that there's a large feeling that many countries squandered the opportunity to make progress on such systems over the summer while cases weren't so high and are paying the price now. There's a lot of conversation around whether a circuit breaker, like a very short, sharp lockdown would be really helpful. We're doing those experiments now. So I think there's a lot to be learned and a lot more targeted, nuanced policy to be made. Yes, absolutely.
Richard Berner, the question is, how can we ameliorate the scarring from the pandemic on our workers, especially those affected by racial disparities and businesses? And I'll just open it to the panel, but clearly the light has been shown on the vulnerable populations having this virus having a disproportionate impact. And in the past, those sort of things, many people would just look in the other direction. This time around, it is so clear that the vulnerable populations are being impacted. Any reflections on his question? How do we ameliorate the scarring from this?
I think part of the answer, the part that I can answer is get it over as fast as possible. Short, sharp recessions leave a lot less scarring than long, deep recessions, because it takes some time for if I take the metaphor, the scar tissue to build up. The part of it that had to do with racial prejudices is a much, much longer process, a very long We've been dealing with this problem in this country for hundreds of years, literally, and aren't close to licking it. I don't have any magic bullets, but the one part that's easy is a quick rebound.
Yeah, driving the economy back to full employment would be the best thing that we could do to help people of lower and moderate income. And to your point about the burden of the pandemic falling disproportionately on lower and moderate income households, not just in terms of the pandemic itself, but also in terms of the difficulty of actually staying employed and working from home with your kids that aren't in school, and all the things that are much easier if you have a white collar job and can work from anywhere. I mean, so this pandemic has been tremendously unfair in terms of the incidence of burdens borne by different segments of the population. And I think we need to acknowledge that and then tailor our fiscal response with that in mind.
A little bit on small business. Torsten Schlock, given the challenges with the PPP program, what is the best way for fiscal policy to support small businesses during a pandemic?
I wish I knew that. I wish I knew the answer to that, or that Torsten did, and he would tell everybody else. I think, let me say one thing. If, and this is a big if, the vaccine can get us over this relatively quickly, over the worst of this relatively quickly, and back into something that looks like a better functioning economy, loans with very generous terms. The limit of that, of course, is total forgiveness, but in general, loans with very generous terms that can get a small business over 2-3 months or something like that and be ready to go back into something approximating normal business is probably the best thing that I can think of, but certainly not a panacea.
You really want to distinguish between the types of businesses. If you're a restaurant or a hotel, the consequences on you are going to be far greater than the consequences if you're like a grocery store. So I think the original PPP program was pretty indiscriminate. I mean, it gave a lot of money to everybody. And I don't think it distinguished very much between who was really getting hurt the most in terms of the economic damage versus who was not. And so I think a program needs to be tailored a little bit more finely than what we saw last summer.
Devaluation of the dollar. Sharman and Mosava Rahmani, will easy monetary and fiscal policies globally lead to a devaluation of the dollar and other non-reserve currencies versus gold?
Versus gold. I was about to say, if everybody's doing it at the same time, You don't have much of an effect on exchange rates versus gold. You know, I don't know how to answer that. I think gold is a panic asset. So when there is panic, gold goes up. If you could relieve panic, gold goes down against currencies, against real monies. I think that's the closest thing I come to an answer to that.
The other thing
Yep.
you'd say, when interest rates are really low, the opportunity cost of holding gold is really small. And so gold also responds to the level of interest rates. And so I would imagine if interest rates start to go up sometime down the road, then gold will suffer the consequence of that. But to Alan's point, I mean, the dollar will be, you know, if everybody's easing monetary policy and fiscal policy altogether, shouldn't have a huge consequence for currency, relative currency valuations. But you know, we've seen gold prices do well, and I think it's partly due to the uncertainty being very high right now, but also just the low level of interest rates. The carrying cost, you know, the foregone return of holding gold rather than being invested in a bank CD is pretty trivial at this point.
Question, it comes back to vulnerable populations a little bit indirectly on income, wealth, inequality. Timothy Monahan, which fiscal policies do you think have the most ability to promote more income/wealth equality?
I would put on Bill will probably weigh in on this too. I would put on the top of the list SNAP, what we used to call food stamps. That's very well targeted where there is need. I would put on the list unemployment insurance, although I think we've done it in a very clumsy way. And I would put really very, very low on the list across the board tax cuts, like a payroll tax cut or an income tax cut.
Yeah, I agree with that. I also think there's, you know, focus on, you know, education and opportunity. So, you know, student loans is an area, financial aid for education, the level of tuition costs. So, you know, there also could be things done to encourage people to, you know, build their human capital, and the government could make that more, you know, financially feasible for people who have less financial capability.
Julian Pinter, do you think that other central banks will follow the Fed and go towards average inflation targeting approach with an unofficial goal of inflating away public debt?
I'll let Bill go first on that.
I think the logic of what the Fed did made sense. I mean, the Fed was underperforming its 2% inflation target for many years. And because of that, inflation expectations were starting to become a little soft. And if that were to continue indefinitely, you know, the Fed would have sort of lost an important anchor for U.S. monetary policy. So I think the logic is quite compelling. So it really depends on where a country is. If the country is doing a good job achieving its inflation objectives already, there's no real need to move to an average inflation regime because inflation expectations are anchored where you want them to be. I think, you know, you're going to see something similar. I mean, the ECB is doing their own evaluation, European Central Bank doing their own evaluation of their monetary policy framework. And I think what you'll see there is probably a similar movement in the same direction, probably not to the same exact outcome, just because the policy that the Fed has implemented, I think broadly makes sense. But it's only relevant if you're, you know, chronically missing your inflation target. It's not relevant if you've been hitting it.
Let me just add to that. It's actually only attractive if you've been missing it on the downside. If they had been missing this on the upside, and that was going to lead to a tougher monetary policy, nobody would really be taking the notion seriously. The other thing I want to say is, I hate to say this as an alum of the place, I think the Fed set a bad example in promulgating the basic idea because of its vagueness. Nobody really knows what it means. And therefore, and I think that's one of the reasons that it's not affected inflationary expectations, because, you know, they didn't, it's an average over which years, how long, how fast will you try to get back to average? You know, there's a dozen questions like that, which the FOMC knows about and deliberately did not provide any answers to. So I think given the vagueness of the way they designed the average inflation targeting regime, it won't have much of an effect on anything, and it's not a good example for other central banks. So I don't think they're going to be Federal Reserve envy. You did this, it was so great, we want to do the same thing.
If I could just add to that, the reason why there was that hand waving is because the Fed knows it can't control inflation precisely, because the economy gets hit with shocks in terms of energy prices, productivity. So it's hard to commit that we're going to do this over a set period of time, because by definition, you're almost certainly going to fail because you'll be pushed off course by shocks that hit the US economy. I think Alan's right, it is definitely a deficiency of the regime. But the reason why they're so vague is because they know that they can't actually hit their inflation targets precisely. And we've seen that over the last decade.
Looks like we
I
lost.
think we lost our moderator, at least he disappeared from the screen.
I'm going to step in. I don't know if Bill lost connection, so I'll go ahead and pose the next question.
Yeah, go ahead.
Will China's effort to become a reserve currency affect the Fed's work, particularly given the large treasury holdings? And a tag on to that, how likely is the US going to suffer the fate as Japan did when their debt bubble popped?
So, the dollar as a reserve currency is likely to last for a long time as long as the US follows a credible sustainable set of monetary and fiscal policies. And I think we're actually pretty far away from the Chinese having a successful reserve currency, because to have a successful reserve currency, you need predictability in terms of the legal framework, and you need to have open capital markets. And I think the Chinese have shown that when the markets are moving in ways that they don't like, when capital is moving out of the country, they clamp down. We saw just recently with Ant Financial that was going to do an IPO just about a week ago. That was pulled off the table. So I think, the desire of the Chinese authorities to maintain control, I think, is a little bit in tension with the goal of the Chinese renminbi being a reserve currency.
Well, thank you. Thank you all. Again, a number of other questions. Jessica, let me just close, and we'll close here in just 2 minutes. Are you teaching this semester?
No, I'm going to be teaching in the spring.
Reflects it a little bit. Alan, I've forgotten who asked the question. It was in the chat room, but in our first conference back now 6 months ago, whenever it was, you basically said in the fall, just expect there to be a lot of Zoom classes. Just from an education standpoint, again, we're essentially out of time here, but a little bit from each of you. And Jessica, let me start with you. Education, Zoom, where we are now, looking ahead, how's it going?
So it's hard. I think it's hard. I am in a slightly unusual position because what I teach is essentially the crisis of the day. And so it's quite easy to be engaged both as an instructor and I think as a student. But it's incredibly hard. I think that how you teach equitably, how you test fairly, all these things are really important questions that we're all grappling with and we're all figuring out how to approach sensibly. I think the question of whether school for younger kids should remain open is also a very interesting one, and possibly one that should be weighted in terms of yes. I think they probably should, for a range of reasons that might take a while to go into.
My answer, I've been teaching Economics 101 this term. I still am. I got a few more lectures to go. And I think one thing we've learned is that the University of Bologna system is far superior to the electronic delivery of lectures. I can't wait to get back live. My students can't wait to get back live. Everything is more difficult to do this way, which is not a criticism of Zoom. I think Zoom is a wonder. I mean, I'm amazed at how good it is, that it works, first of all, that it has an unbelievable capacity. So this is not a criticism of the people that are behind Zoom, but frankly, on a 1 to 10 scale, if a regular Princeton lecture in Makash 50, where I've often lectured, is an 8, you don't get a 10 because it's a big room and it's hard to communicate. Zoom is a 3.
You know, it's interesting, and everybody listening to us right now, not everybody, but I bet 50% have kids at home or every day struggling, whether or not the class is going to be closed down the next day. And so it starts really early. Bill, you had to,
And
you'll say
the
something?
other thing, you're just losing all the other aspects of the university experience. So it's not just the classes that people are missing out on. You're missing out on all the other parts of their human development, which is pretty significant.
Well, thank you all. I mean, it's been terrific to have an hour and a half with you, really looking at the economic issues and the social issues, the medical and the clinical issues. It's a real privilege for me, and I know it has been for our listeners. And I want to thank our listeners. We had a lot of listeners coming in from around the world joining today's COVID-19 discussion. It has been sponsored by Princeton University's Griswold Center for Economic Policy Studies, as well as the Center for Health and Wellbeing, as well as my podcast, the Second Opinion podcast, Rethinking American Health. As I mentioned earlier on, a full recording of today's remarks and an entire discussion will be posted on the Griswold Center's website, and then next week on a Second Opinion podcast, which you can find wherever you get your podcasts. I guess in stepping back in closing, I want to briefly share that I'm pretty optimistic about our future. And I say that, and a lot of people say, "Are you crazy?" But in the near short term, the things we've talked about, a highly effective vaccine surpassing any of our expectations, with as fast of an acceleration, a faster timeline as we've had, will help us turn the corner on the pandemic. We're not there yet. We have to go through the distribution issues. We've had this return, I think, and this movement towards returning back to sound evidence-based science that we've lost in the last few months, but there's this feeling out there, in part by the news on the vaccine, that science is really important and we need to trust it a lot more, and it can accelerate our return to healing type issues. And I'm optimistic, the elections, and, it's kind of chaotic now, but the fact that we have had peaceful elections, that we had these huge turnout, these historic levels of voter turnout, at the same time we had this pandemic going on, is truly amazing, but to me, really encouraging. And all of this is with the backdrop of really important discussions going on addressing social justice movements. We didn't see the red wave and we didn't see the blue wave. And I think that does speak to this empowering diversity that we have in our nation. And that diversity may just actually be a fantastic, powerful, robust strength for President Biden as he seeks to put forward policies that over time can be sustainable and important and move the country in the right direction. And clearly he's going to take civil discussions and ultimately bipartisan support. So thank you all for coming in, for tuning in. Be sure to share these remarks with other people in the upcoming days. I want to thank all three of our panelists. And until our next discussion, thank you for joining us today.
Thank you all.
Thank you.